So welcome back. We're off to a great start. And thank you, Dr. Jan, for that wonderful keynote presentation. About our next speaker, Mike Giresi is a Florida certified addiction counselor and an internationally certified alcohol and drug counselor. He comes to us recommended by MHA board member David Cunningham, who is with Augustine Recovery.
Hi, everyone. Welcome to NARM and working with teenagers, adolescents as emerging adulthood. Before we get into it, I just want to thank Ben and MHA Eastern Tennessee for having me here. It's a privilege to be able to present something that that speaks to my heart and the work that I do and what I'm so passionate about. So what we're going to get into today is the neuroaffective relational model, or NARM short, in its application and theoretical understanding of working with the specific developmental time period of teenage years. I'm Mike Giresi. I'm the Director of Clinical Development at Family First Adolescent Services in Palm Beach Gardens, Florida. We're a residential treatment center for adolescent boys 13 to 18. 18 if they're still in high school, hanging around high school kids, and I like to say that they don't have a better beard than me. If they have a better beard than me, they might not be a good fit. They're probably hanging around some older kids and getting into stuff that wouldn't be a good fit for us. But the overarching kind of umbrella theoretical orientation that we utilize here at Family First is the neuroaffective relational model. And hopefully you'll get a sense as we explore this as to how we hold this relational approach as at the forefront of the work that we're doing with teenagers. So let's get into it. So first, I just wanted to kind of outline the intention of this presentation, which really is geared towards supporting professional and personal reflection into the impacts of the adolescent stage of development on the developing sense of self, and how we can really support greater clinical attunement when working with adolescents. So some of the questions that I'm going to invite everybody to kind of have running in the back of their minds as we're going through this is, how can we meet teenagers with openness, curiosity, spaciousness, humility, and patience? How can we use a psychobiological understanding of the developing self to support teenagers and their families? Psychobiological being a fancy way of saying body, mind, or brain nervous system. How can we manage our own internal reactions and expectations when working with teenagers? And how can we most effectively support teenagers as they're moving through this incredibly critical phase of development? The intention is really to utilize these NARM organizing principles to depathologize, destigmatize, and ultimately humanize the adolescent experience. The goal is really to support clinicians and other helping professionals working with teenagers with a clinical approach that provides understanding, compassion, and what we like to refer to as heartfulness, and increased opportunities for connection. I wanted to give a little special shout out to anyone who's holding or wearing multiple hats as they're attending this, wearing your professional hat and then also your personal hat. Some of you, I imagine, are also parents. So I wanted to give a special shout out to this and speak to this dynamic, because we can't completely differentiate them really ever. But what I really want to do is just invite everyone, as you're taking in this material, to be as compassionate and kind with yourself as you possibly can as we explore this topic. I really believe it'll be supportive to just at a baseline, acknowledge your willingness to be open, learn, and grow as a parent. truly even reflecting on, like, just taking a moment to reflect back and think about how it would have impacted your life as a teenager to have a parent who was doing exactly what you're doing right now. If you're anything like me, the idea is actually kind of comical that your parents would be attending a talk around learning about how, you know, they've impacted you, learning about your internal world. That's kind of hilarious in my experience. But I can only imagine what it would have been like, not only just like receiving the information, but just having parents that truly their intention was to be open and to learn and to grow so that they can support me more effectively. I can't even imagine what that have done would have done for my life. And truly, that's the gift that you all are giving to your children just right in this moment, no matter what their age is, whether they're teenagers or they were teenagers, they're grown, they're smaller. That's really the gift that you're giving to them right now. And just taking a moment to reflect on that or take that in to whatever degree feels comfortable to you. And taking another kind of step in the direction of self inquiry, I'm going to invite everybody before we get started to do a little self-reflective exercise. And the focus we're going to be doing right now is on your own teenage years. Doing this to whatever extent feels good to you, eyes open, eyes closed. And particularly reflecting on the challenges you had within your family, your peer, and your romantic relationships. Remembering the challenges you had within yourself. And noticing the different sensory and emotional details, thoughts, feelings, impulses as you reflect on this experience. And when you're ready, gently bringing yourself back. So we're ready to jump into NARM and adolescence. First, just a little bit of context. NARM is a model that was specifically designed for treating attachment, relational, and developmental trauma. What's being coined in our phrase, being the coined phrase most recently for in our field, is complex trauma or complex post-traumatic stress disorder, which is actually a new diagnosis that was announced by the World Health Organization back in the summer of 2018, and things got slowed down for all the reasons that we all know. But it should be actually put into the next revision of the ICD-11 diagnostic manual. So just to give you some context around what this is all about, complex post-traumatic stress disorder, which is all about developmental trauma and the failures of our environment to adequately support our development as children. Complex trauma truly results from chronic misattunement. So on the extreme end of the spectrum, misattunement would be neglect and abuse. On the more subtle end of the spectrum, the way I like to think about misattunement is like, you know how even as an adult in adult relationships, the experience of not feeling felt or not feeling understood by a partner or a friend or a coworker, in those experiences, they don't typically feel great. They might be mildly annoying or frustrating on some level, but that's pretty much the extent that it typically goes. For a young child who their entire survival is completely dependent on the attunement from their environment and their caregivers, not feeling felt, not feeling understood being misattuned to actually feels deathly threatening. So this chronic experience of misattunement from caregivers and or the larger holding environment, what happens is that children are literally hardwired to internalize the failures of their environment as a way of protecting the relationships in which their survival is completely dependent. It's too much for a young child to experience their environment as failing them. So they internalize these failures as being about them. Because if they can make it about them, then they can hold out hope that if they can change themselves, if they can adapt, if they can move in a certain way, that there's still hope for love, there's still hope for survival, there's still hope for the things that they're wanting for themselves. The internalization of these failures leads to a wiring in the brain and the nervous system at very critical early childhood stages of development of psychobiological shame patterns that go to the root of their identity development or the development of the self. We know a lot about these kind of environmental failures from, I'm sure a lot of you are familiar with the ACEs study, or the Adverse Childhood Experiences study. It really did do a great job of providing us with a way of understanding the various forms of environmental failure that impact early childhood. I really love this graphic from this website, ACEs Connection. I think they actually recently changed their name to Paces Connection, but here they show this larger context that the original ACEs study actually didn't really touch upon so much, where if you look at the graphic in the next to the number 1, these are kind of the 10 original survey questions that you could think of as all of those particular early childhood experiences of adversity that happen within the household: incarcerated family members, physical or emotional neglect, bullying, domestic violence, alcoholism and drug abuse, emotional and sexual abuse. And of course, we know from the ACEs study how these have such a large impact on the development and prediction of long-term health outcomes, both physical and mental health. But that's not the whole story, because the household exists in the context of the roots, the communities, the larger environment that the household is held within. And when these roots within the community are wrought with discrimination, historical trauma, violence, substandard wages, structural racism, lack of social capital and mobility, poverty, poor housing quality and affordability, of course, that context is going to impact the level of stress and impact on parents who are responsible for the development and kind of care of the children that are experiencing these things. Then as you zoom out even more, you have environmental impacts of natural disasters, a pandemic, the climate crisis, storms, wildfires, hurricanes, all of these different things that are largely outside of our control in many respects, that of course are going to have a further impact on our communities, are going to have an impact on our systems, on the adults who are responsible for caring for children. So this trickle down kind of cascading effect of all of these environmental impacts having such a complex kind of I guess impact is the right word, on a developing child. The As you start to look at this, it typically becomes pretty overwhelming. you really do start to get the sense of truly why this is being called complex trauma and just how complex all of these dynamics really are. The reason this is so incredibly important to understand, just kind of thematically, is that a child experiences internal security through the security of their early environment, particularly through the security in their attachment relationship. Insecurity in their attachment relationship leads to a child experiencing a lack of internal security. This insecurity leads to a disruption of the development of a secure sense of self. Actually, one of the 3 additional symptom categories for the new complex trauma diagnosis is negative self-concept. A sense of self that's rooted in shame, guilt, self-hatred, self-criticism, self-rejection. These dynamics going so closely to the heart of what it is that's driving the disruptions of complex trauma. The idea is that due to the lack of internal security experienced in the attachment relationship, children will simultaneously experience challenges in their capacity for separation individuation. So we're going to get into that in just a minute, but the idea is that, kind of simply put, insecure attachment then leads to challenges in separation individuation. The whole purpose of the attachment process and relationship is to provide a secure base and foundation with which then a child can securely individuate from. When there's been insecurity in the attachment relationship, a child adapts in various ways, making it very challenging for the individuation process to be successful. The concept of separation individuation, for those of you who aren't maybe as familiar, or those of you who are and just want to hear the context in which I'm going to be using it, is thinking about its origins as just a child's organic movement towards differentiating the self from the other. This movement towards differentiating self from other over time actually turns into a state of experiencing the self as differentiated from the other. We might refer to this state of experiencing self differentiated from other as authenticity. In NARM, we actually refer to this connection to the self while being connected to the other as this 50-50 balance, to describe an individual's balance between connection to self and other. One of my favorite, authors and speakers and theorists on a certain level is Dr. Gabor Mate, a famous trauma and addiction expert. He actually talks about this 50-50 balance in a certain way himself, where he talks about this conflict that happens between our need for attachment, so our need for connection to others, and our simultaneous need for authenticity, a connection to the self. And he's just like wrought with amazing quotes. So parenting is not about techniques, he says. Parenting is about a relationship. It really is that simple, because that's our essence. Authenticity be you, attachment be us. And we're going to take a listen to a short video of him actually narrating this thing from it. It's a thing that was put together from an interview he did, where he talks about this tragic conflict between attachment and authenticity when our attachment needs and our need for authenticity aren't compatible in an early environment that isn't adequately supportive. So let's take a listen.
Child is born, the child has two needs. The first need is for attachment. And attachment is contact, connection, love. Without that, the human child does not survive. Even an avian child doesn't survive. The baby bird has to have an attachment with the parents. The parents have to be attached to the baby. Otherwise, the infant simply does not survive. Mammalians even more so, and most so the human, because we're the least developed, the least mature, with the least developed brains, and the most dependent for the longest period of time of any creature. So our attachment needs are enormous, and they remain important throughout lifetime because we have to have attachments to form societies, social groups, without which we don't survive. So attachment is a huge need. We have to connect, belong, be loved by, and love. That's just a basic human need. But we have another need as well, which is for authenticity. The authenticity is the capacity to know what we feel, to be in touch with our bodies, and to be able to express who we are and manifest who we are in our activities and in our relationships. Now, why is that? Well, think of a human being in the evolutionary period who's not in touch with their body and their gut feelings. How long do they survive out there in the wild? So authenticity is another huge survival need. But what happens to a child where the attachment need is not compatible with the need for authenticity? In other words, if I'm authentic, my parents will reject me. If I feel what I feel and express what I feel and insist on my own truth, my parents can't handle it. And parents convey those messages unconsciously all the time. Not because they mean to, not because they don't love the child, but because they themselves are suppressed, or traumatized, or hurt, or stressed. Now, what does the child do with that? Well, if I give up my attachment for the sake of authenticity, I lose my relationships on which my life depends. Therefore, there's no question. What becomes suppressed is our authenticity, our emotions. And then we become 35, 40, and we don't know who we are. And somebody asks us, what do you feel? You say, I have no idea. And how many times we've all had the experience of having an inkling of a strong gut feeling, but we're ignoring it. We're ignoring it and we get into trouble. Well, that tells us what happened. What happened was that at some point we found out that it was too costly for our attachment relationships to be in touch with our gut feelings. So then it becomes not our first nature, but our second nature to lose touch with ourselves and to suppress our gut feelings. And then we pay the cost later on in the form of addiction, mental illness, or any range of physical illnesses. But it all began with this tragic conflict that children should never be confronted with, but are all the time, between authenticity on the one hand and attachment on the other.
He's incredibly eloquent. The idea is that, there's this guy's name was John Bowlby. He's the father of attachment theory. Many people think of him as that in Western culture. And he had this theory that he called the evolutionary expectation, that all children, all babies are born into the world expecting that they're going to be loved, nurtured, and have their needs taken care of and met in all the ways that they need. And when this doesn't happen, for any of a billion different reasons, what ends up happening is a certain kind of heartbreak inside of the child. And this heartbreak is too much for them to tolerate or handle. So what they do is they adapt by disconnecting from parts of their heart, parts of themselves, and adapting to what's available to them in their environment rather than what it is that they actually need. This process of disconnecting from their hearts and adapting to their environment becomes wired in the brain and the nervous system and carried forward as what we refer to in NARM as adaptive survival styles. These psychobiological patterns end up actually being at the root of what's so often the driving force of the symptoms and behaviors that people are struggling with. The largest internal conflict for adolescents, if you could imagine, is around separation individuation. So let's think about this for a moment. When we think of the primary purpose of the developmental stage of adolescence, it is to begin this individuation process to support them to successfully become adults, both physically, emotionally, relationally, and otherwise. But when there's been early trauma, separation, individuation, or a connection to that which is most authentic to me is at the onset of puberty, both what I desperately desire, but now it's also what I fear the most. So this intrapsychic conflict ends up happening around the primary purpose of this developmental stage. The original title of the book that introduced NARM to the world, the actual book title is Healing Developmental Trauma, but the original title of the book was actually Connection, Our Deepest Desire and Greatest Fear. And what we're going to be really exploring here is how individuation for an adolescence is their deepest desire and greatest fear. And understanding that contextually can really help shine a light on what it is that's actually happening in the inner worlds of the kids that we're working with. If we look at adolescence as the second developmental phase of separation individuation, the first one happening from the birth process or in utero up to right around 3 years old, a very famous book, The Psychological Birth of the Human Infant, by Margaret Mahler, outlined these very specific stages. We won't go into that, but thinking about this as kind of the flip side of the same coin of the second round of this individuation process. Adolescence is actually a time of just unbelievable brain and nervous system, or what we might think of as psychobiological reorganization, integration, and developmental transformation. Adolescence is actually second only to the neonatal period in terms of both rapid biopsychosocial growth as well as changing environmental characteristics and demands. We can really start to think of adolescence as the bridge between childhood and adulthood, or what we might think of as the stage and process of emerging adulthood. While children are moving into the stage of emerging adulthood, they're not yet fully functioning adults, obviously. The adolescent, thinking of it like this almost, it's like they're splitting the difference. It's like they have one foot in childhood and another foot in adulthood. And so I do consultations for people all around the country and the world around how to effectively attune and support teenagers. And one of the most common dynamics that I come across time and time again when working with people is that it's really challenging to not get fixated or focused on an approach that moves in one direction or another. If you think about it, let's say you're working with a 16-year-old, we want to support them in a way that we're not treating them like they're 6, so they're completely dependent, they have very little agency or capacity. But we also don't want to treat them like they're 26, where they have a lot more capacity, choice, agency, all of these other more time for brain and nervous system development, environmental expectations. So how do we not infantilize them like 6-year-olds, or hold them to expectations that are just unrealistic? How can us as adults treat them appropriately like a 16-year-old? James Masterson discussed this this theory. It's actually pretty common still, if you think about it. It's called the adolescent turmoil theory, which was one of the kind of prevailing beliefs back in the 50s and 60s, where the idea is that adolescents that met criteria for therapeutic treatment don't really need it because they're just going to grow out of it. Adolescence is simply a period of turmoil and harmful behaviors, and therefore those things are normal. Masterson disproved this theory, demonstrating that children actually don't grow out of their problems, that these behaviors are actually driven by what he referred to as pathological character traits. We're going to update the language here a little bit from Masterson, but these pathological character traits that he was referring to, actually a little bit later in his career, were the building blocks of what he ended up calling the disorders of the self triad. If you've ever worked with a client or clients with borderline personality dynamics, you might be really familiar with Masterson's work. He coined the model, the borderline triad, and that all that work was actually compiled in his work with adolescents, because he noticed this very sequential theme of what it is that's actually happening in this dynamic, where the first kind of trait that he talked about, or the first part of the sequence of this triad, was self-activation. So self-activation you can think of as, it's almost interchangeable with self-actualization. So it's like any uptick of connection to the self. So connection to what it is that we most need, what we most want for ourselves, our heart's desires, our emotions, any uptick of connection to the self at some point triggers this original fear of attachment loss, which he refers to as abandonment anxiety and depression. So a connection to the self triggering the fear of attachment loss or abandonment anxiety. And then from this state of abandonment anxiety and depression comes the third part of the triad, which he referred to as defense, which we might think of as acting in towards the self through self-criticism, self-hatred, self-sabotage, all of these different behaviors of pointing aggression towards the self, or acting out, pointing aggression out towards the environment. These, what he calls defenses, or these acting in or acting out behavioral mechanisms, were a way to manage the disorganization, pain, and threat associated with an inner world that desperately wanted to be connected to the self and other, but felt as though it was impossible to do that. So they must disconnect from themselves or must disconnect from others in order to stay alive. when we think about self-activation in the context of adolescence, you can think of puberty as this organic process of an expression of self-activation. All new stages of development are an expression of self-activation, but puberty in and of itself is this initiation of a recognition that the child moving into emerging adulthood is starting this new process of separation and individuation. When parents, and I'm sure so many of you who work with teenagers experience this, but when parents struggle with their child's newfound self-activation connection to the self, they can often take personally the separation individuation process. And so often what they'll describe it as is it's almost as if it's a rejection of them as parents. We'll talk about this more in a little bit, but so often what this speaks to in a family system is that individuation from the family system feels like a threat to the system itself. This is because of largely the attachment figures in that family system have their own unresolved dynamics around separation and individuation inside of themselves. And so they project this threat onto their children and experience their individuation process as threatening. So what I'm going to do again, as we did at the beginning, is just to kind of take a moment to digest some of this information and do a little reflection. And the reflection is going to be on your own relationship to self-activation, particularly around how did your parents respond to your efforts to creating space for yourself? How did this feel for you to try and stay in relationship with them as you navigated your emerging authenticity? Did you have to disconnect from them in order to connect with yourself? Did connecting with yourself pose a threat to your relationship with them, so you had to disconnect from your authenticity in order to stay in relationship with them? Some mixture of the two in different ways? And we'll keep going. I love this quote. Adolescence represents an inner emotional upheaval, a struggle between the eternal wish to cling to the past and the equally powerful wish to get on with the future. Cling to the past, attachment. Equally powerful wish to get on with the future, individuation. The challenge of adolescence comes largely as a child begins to renegotiate their relationship with their parents from an increased place of separation, individuation. The renegotiation happens in relationship to their parents in the present moment. So the real-time parent that's right in front of me. This relates to the emerging kind of adult capacities to take on new roles and responsibilities and expectations and boundaries, conversations that might be challenging, all of that kind of stuff. But there's another dynamic that makes this just ever more complex, which is that the renegotiation happens in relationship to their internalized parents as well. That what you might think of as the psychological parents, this relates to the internalized patterns that were based in dependency, minimal agency, and negative self-concept during these early disruptions in these critical early developmental stages. So it's one of the reasons why an adolescent so often isn't actually experiencing their parent for in a certain kind of consensual reality, where the parent may say, "I love you," and the child, as it that those words get filtered through these internalized patterns of dependency, minimal agency, and negative self-concept, it becomes distorted. And what they hear is something completely different than "I love you." They often will hear a criticism, or that they hate them, or don't think that they're enough. These patterns, we can think of them almost as filters. Unless these are renegotiated to start shifting internally, the renegotiation process in the present moment to the actual parents in real time is going to be really challenging. Teenagers want to be treated as adults, but not really held to the expectations and responsibilities of an adult. The desire, but this makes sense in context if we think about it. The desire for increased space, freedom, and authenticity is a form of what we think of as psychobiological expansion, or what we refer to in NARM as self-activation. The fear of these internal states of increased space, freedom, and authenticity is a form of psychobiological contraction that commonly manifests as anxiety, depression, and other psychobiological challenges that limit one's capacity for self-activation. And I love memes, so we're going to do a meme here. This might sound familiar to some of you. Who are we? Teenagers. What do we want? We have no idea. When do we want it? Now. Yeah, I'm sure that may have even triggered some of the parents in the room. So let's take a little bit deeper look at this idea of expansion or individuation and contraction or self-shaming, these internalized patterns. As adolescents experience glimpses of freedom and increased possibilities for themselves, what we can bet on is that they will also experience fear of how growing up threatens their attachment relationship. While the expansion toward new life may be really exciting, it may also be experienced as really, really scary. As an unconscious way of protecting against attachment loss, adolescents will contract away from their psychobiological expansion, contract away from connecting with what is most authentic to them. This self-shaming mechanism is the psychobiological process that disrupts separation, individuation, and self-activation. Self-shaming during adolescence can be observed in a million different ways, but I'm going to outline a few for you right now, which is self-criticism, the actual attack towards the self, self-doubt, self-rejection. So I'm not going to ask that person out because they're just going to reject me anyway. So I'm rejecting myself in favor of not being rejected by the other. Self-hatred, annihilation, self-sabotage. I want good things for myself, but I undercut myself because to have those things actually feels too threatening. And self-isolation, withdrawal, depression. These swirling internal patterns of how it is that we disconnect from ourselves through the process of self-shaming that ultimately limits our ability to become who it is that we really are. Developmentally, so this is kind of going back to talking about the parents a little bit, it's necessary for parents to still be active caregivers for their teenagers, despite the pushback and mixed messages their child might be giving them. Many parents so often feel really intolerable states of helplessness with their teenagers. So they just don't know how to be as parents during this stage. It's so different than when they were so dependent on their parents. Our relationship as adults and parents, though, to our helplessness, not the helplessness itself, is often at the root of what's driving the feeling of disconnection from teens. In your role as a parent and or helping professional, we're going to do a little self-reflective exercise again to take a few moments to reflect on your relationship to helplessness in the different aspects of supporting teenagers. When you just can't affect change for them when you really want to, when they're suffering and self-sabotaging, what happens inside of you? And what do you do to yourself in relationship to that? Do you take responsibility for things that you're just not responsible for? Do you override your impulses? Do you leave yourself to be with them? Do you leave them to be with yourself? What's your relationship to this helplessness dynamic that's so real in adolescence? So let's keep going. We can actually differentiate kind of three forms of helplessness for parents and for professionals, which is the real limitations of what a parent can do to impact change for their child and their relationship with their child. There is nothing you can do to control what it is that your teenager does internally with what you say to them or how you act towards them, how they internalize it, how they filter it, what they do with it ultimately has nothing to do with us on a certain level. And accepting the real limitations of what we can do to impact a certain kind of change is often associated with a certain kind of helplessness. Another form of helplessness for parents often is their own unresolved complex trauma, their own patterns of how they shame, guilt, reject, criticize, and hate themselves. These filters with which they adopted early in their lives in order to stay protected and safe that are now impacting their relationship with their children, their partners, their friends, other aspects of their lives. And what we think of as this dynamic called projective identification from the teenager themselves. So oftentimes when a teenager is struggling with their own sense of helplessness, they will actually, and oftentimes this is not conscious, sometimes it is they will actually project this feeling of helplessness that they're experiencing onto their environment by creating certain kinds of dynamics, either in the parenting relationship or the therapeutic relationship, where they're wanting you to feel helpless so that you can experience what it is that they're experiencing. And they often will even think of it as like a getting back at them kind of a deal that, you hear from teenagers all the time when their parents are trying to share with them, I feel helpless, I don't know what to do. And they'll actually, the child will actually smile on a certain level. There's a gratification in the idea that they are effectively on some level communicating what it is that's happening in their inner world. It gets distorted and doesn't come off the way that they want it to or produce the results typically that they want it to. But in and of itself, it creates another complex dynamic for adults to work through as they're supporting them. Circling back to this idea of around the 50-50, connection to the self, connection to the other, it also shows up as parents navigate their changing relational kind of dynamics with their teen. When parents, in attempting to manage the helplessness, move in one of two kind of polar directions. So thinking of pushing for developmentally premature counter dependency, meaning they're just not involved at all on some level in their child's life, where this 50-50 balance gets out of whack. You might think of it as only 10% connected to the child's experience and 90% connected to their own. Or the opposite, which is pushing for developmentally inappropriate codependency, which is kind of all about an imbalance in the other direction of maybe remaining only 10 or 20% connected to myself, leaving myself largely and being 90 or 80% connected to their experience, that the vast majority of what I'm experiencing is actually all about them, and that there's such an enmeshed kind of relational dynamic that it's hard to tell where I end and they begin. Adolescence is largely this kind of in-between state where they're in the process of disconnecting from their family system, but they're not yet fully connected to themselves. This isn't actually a problem, though. This limbo state, a part of this differentiation process of self from other, is a form of two different things: disorientation and what we think of in NARM as disidentification. Disidentification meaning the actual renegotiation of these early internalized shame patterns, that I'm disidentifying from those patterns that I took to be who I was, and I'm starting to relate to myself in a different way. The disorientation experience, a teenager may be deeply confused, uncertain, lost, grasping for old and new strategies to help orient them to a new way of being in the world. And disidentification is really speaking to how a teenager may be beginning to experience glimpses of freedom and possibility, where oftentimes therapists and parents will get stuck. They see this disorientation and disidentification process, and they see the confusion, they see the uncertainty, they see the anxiety, they see the different kinds of internal states that may be really uncomfortable for the teenager, and they try to jump in and fix it for them, which does what to their relationship to these internalized patterns of dependency, lack of agency? It reinforces them. Where this disorientation and disidentification process, actually, when we're able to hold a certain kind of trust and space for their capacity to reorganize in a way that moves towards healthy individuation, that's what the role of the contextual environment can really play in not just jumping in to fix things for them, but hold them to the standards that they want to hold themselves to. Erikson kind of talked about this in this psychosocial conflict in his developmental model around role confusion versus identity. How am I supposed to relate to myself given this newfound role and responsibility and different capacities in which I'm taking on in my life as an emerging adult? And how this conflicts with these early patterns of negative self-concept that I adopted early in life. Adolescent behavior is often referred to as kind of like detachment. And so often adolescent treatment and behaviors is almost purely looked at from a behavioral perspective. And this makes sense because, it's like due to the different acting out strategies, including challenging parents and adults and authority, this process of detachment has often been looked at as a bad thing. It's important for us to really sit with and reflect on and differentiate between healthy differentiation and detachment, disconnection from the other in order to connect with the self, and healthy differentiation of remaining connected to the other and the self. And to kind of get a better understanding of what we're talking about here, I'm actually going to invite everybody to do another self-reflective exercise along this, to feel it from the inside out. Really looking at examples during your own adolescence that went in both directions: movement towards healthy differentiation and movement that went in the direction of detachment. And there's no right or wrong answer to this. It's just a way of reflecting on the differences that you experience. And particularly what I'll invite you to do is identify, how are you able to see the difference? What is it about these different experiences that speak to the different outcome or the different state that it was supporting? And we'll keep going. When we look at, when looked at from the parents or adults who want the child to comply, detachment is seen as reactivity. It's seen as rejection, and often it's seen as violating very deeply held familial, cultural, and religious beliefs. When viewed from a developmental perspective, detachment can actually be part of disidentification and creating space from family and other larger systems for an individual to begin finding themselves. And I love this quote: "Not all those who wander are lost." So as you were reflecting on the difference between differentiation and detachment, now I'm inviting you to consider that this detachment actually may have been an attempt or a part of the process of moving towards disidentification and differentiation. Creating space is both desired and threatening by both parents and teenagers. This is that 50-50 idea that I desperately desire to connect with myself, and I'm also deathly afraid of it. So what I mean by this is that parents don't want to feel ruled by how their child is doing, but there's this question that comes up: can I have my life and parent my teen, or must I foreclose on having my own life in order to parent my teen? And the same goes in the opposite direction of a teenager not wanting to feel ruled by their parents, but this question coming up: can I have my life and have my parents? Or must I reject my own life in order to remain in relationship with them? Must I reject them in order to find my own authenticity and have my own life? This dynamic, when happening on multiple levels and multiple people in a family system, the work becomes very complex as to why there are certain dynamics that are staying stuck. But this gives us a little bit of a glimpse as to what might be happening under the hood during those experiences. To understand this important developmental process of creating space, what I'm going to do is kind of differentiate between internal space and external space. So the state of internal space and the behavioral movement of external space. For example, moving away from parents by preferring to be alone or with one's friends is behaviorally creating space, but not necessarily creating internal disconnection from the parents, although often parents and teenagers experience it as such. The parent will think that the child is completely disconnected from them when they're preferring to be alone or with their friends, but that's not actually the case necessarily. We don't have to be right next to somebody in order to feel connected to them. We don't have to be across the country in order to feel space from them. You can actually experience space inside of yourself in relationship with other people when they're right next to you. A demand for external space is often a teenager's expression of a demand for internal space. For example, many adolescents feel that they need to lock themselves in their room to experience internal space. But if you've ever talked to a teenager that, often does this, they're often sitting in their rooms and these patterns of self-criticism, anger, self-hatred, self-rejection, self-doubt are running the show. So they're not actually gaining space from anything internally. It's actually just an external expression of what they desire internally. But like I mentioned, an adolescent could also be sitting right next to their parents and still experience internal space just as much the same. Some common teenage behaviors, just to paint you a picture, that are kind of expressions of a desire for internal space potentially. One of them is locking themselves in their rooms. We just talked about that a little bit. Daydreaming, escaping the present moment by going off into daydreaming. Doodling, I did that quite a bit in school. A desire for creating some space for myself. Gaming, actually going into an alternate world because this one feels too threatening. Internet communities, pursuits. I don't know if any of you are familiar with this idea of Finstagram. It's where you have two different Instagrams, one that is easily found by your parents and shows you being a model citizen, and then another Instagram that is for you and your friends, where you're kind of showing more of your authenticity and self-expression. Eating disorders as a way of finding control internally, a desire for internal space from the external demands. Cutting and self-harming behaviors, substance use, a way of quieting the noise internally, a way of regulating their bodies so that they don't feel so on fire in relationship to their environments and the expectations in their environments. The two main behavioral strategies that adolescents employ in order to navigate these challenges around internal space are compliance and defiance. We view these behaviors as communications to the environment. They often depict either what you might think of as an under or over response to real or perceived environmental expectations. This compliance defiance dilemma is often experienced as a teenager as literally the only two options that they have at their disposal. in terms of being able to respond to an adult's requests. The compliance is often preferred by adults, but the challenge here is that it may come at the expense of a child's emerging authenticity showing up. The defiance is oftentimes really misunderstood by adults, as it's often a child's best attempt to create space for themselves, albeit clumsy and awkward and doesn't really come off so well. This shift from compliance to defiance is often what you hear when you are working with parents and they'll describe to you, he was so sweet growing up. Where did my nice boy go? Or where did my sweet little girl go? They're so different now. The idea is that they're not actually all that different, not internally at least. They're just behaving differently. Oftentimes, compliance can be a very common strategy in early childhood dependency. And so it comes off as sweet and nice and compliant. And then at the onset of puberty or just thereafter, at the upsurge of the need for a connection to the self and individuation, this defiancy starts to be projected onto and utilized towards adults as a way of expressing the rage and pain that was so under the surface of all of those compliance strategies in the first place. So it's not that the little boy wasn't sweet growing up. That's absolutely true. But there's another side to it, is that underneath all of those sweet, compliant, nice smiles and things like that was a mounting rage and anger around feeling as though they needed to reject themselves in order to be what everybody else wanted them to be. And now they're flipping the script. And then again, I love this quote by Virginia Satir. Adolescents are not monsters. They're just people trying to learn how to make it among the adults in the world who are probably not so sure themselves. I definitely relate to that. So I'm going to invite you to do another self-reflective exercise, whether this be with a client of yours or with your own kids. A time when a teenager you were involved with was compliant with your expectations or your request. And then another time when a teenager, the same or different one, you were involved with was defiant with the environmental or your requests, demands, rules. And as you're bringing these experiences to mind, how is it to reflect on this now that we've described these behavioral strategies in this way? And let's keep going. Just a little bit more, and then we're going to wrap this up. Adults might take personally the defense strategies that we were mentioning earlier with Masterson that are utilized by the teen. When this happens, this is so vitally important, the likelihood of misattunement with teens is far, far greater. Because we're focusing on an adolescent's behaviors at the expense of understanding and responding to where their behaviors are being driven from their internal experience. A feeling of push-pull between parents, adults, helping professionals, and adolescents could be reflecting the underlying internal conflict between a child's desire for individuation and their desire for dependency. At this stage of adolescent development, the desire to be connected with their attachment figures gets confused with the previous stages of development where attachment involved authenticity, or with attachment involved dependency. We can remain connected to our attachment figures without being dependent on them. But at this new emerging stage where they're renegotiating this, this can feel really confusing. And so the way I really love to paint this picture is to understand that any experience that reminds the adolescent that they're still dependent threatens their desire for independence. And any experience of independence feels threatening to the comfort and safety of remaining dependent. Push, pull. For parents, feeling into the push-pull often activates their own internal conflict between dependency and independence. As their adolescent child begins moving into greater need for independence, which can often involves creating more space for themselves, this can trigger the parent's helplessness and unresolved separation individuation dynamics. Some common parental behaviors as an expression of a threat around a child's increasing internal space would be kind of denying reality, not being transparent appropriately, telling them that things aren't happening that actually are, that they aren't feeling things that they actually are. Power struggles, dominating them just because you're trying to show them who's boss. Dominating them into compliance and or coercing them. Overreacting and pathologizing, kind of making things into a mental health disorder when they aren't necessarily a mental health disorder. Violations of privacy, being intrusive, not renegotiate, treating them again as though they're 6 rather than 16. Nitpicking, pressuring, criticizing unfamiliar interests and peers, familiar coming from the root word familial. Surrendering basic parental responsibility. So just resigning because this renegotiation process feels too much. And so we're going to finish up with this last self-reflective exercise that I hope will encourage a certain recognition of what might be most supportive for the teens and parents that you're working with, which is to reflect on the various ways your clients' parents may be either intentionally or unintentionally disrupting their child's attempts to create internal space for themselves through any of the behaviors I just listed or any other ones that you can think of. And as you're reflecting on these parents disrupting the child's attempts, notice any emotions that arise inside of you toward the parents. What might that emotion be trying to communicate about what it is that's happening inside of this teen? Is this emotion on the surface in your sessions? Do you not see this emotion actually? Have you not explored this emotion with them? It might actually shed some light on what might feel threatening for the teenager in relationship to their parents. Because to connect with their authentic primary emotions in relationship to the failures of their environment is an expression of separation individuation, which is a threat to the attachment relationship, which ultimately leads to abandonment, anxiety, and depression, and acting in and acting out, unless we can support a completion of these incomplete emotional responses to unmet needs and emotions in early childhood. So thank you so much for attending this talk with me. Thank you, all of the organizers of the conference. Thank you again, Ben, David Cunningham, and everyone involved in inviting me to be here. It was an absolute pleasure, and I look forward to connecting with you all through some question and answer. Thank you so much.
Mike, thank you again so much. Great to see you as always, and just very informative and appreciated. We do have some questions. One of those is how might the expansion and contraction look different for, say, to a teenager who has been in foster care for a while, but is now has a secure attachment in an adoptive home?
Great question. Well, first off, it's great to see you too, David. I mean, it's so contextual. There's so many factors at play, but I'll say that just kind of in an overgeneralized way, when you're talking about early trauma in terms of adoption, it depends on when the adoption was, it depends on the early circumstances and a host of, potentially billions of other things. But we often think of adoption in the context of this earliest developmental stage, which the core need of that stage is largely around what we think of as the psychobiological need of connection, that a child needs enough safety, warmth, welcoming in order to, from the environment, in order to remain connected to their bodies, to their feeling states, and safe enough to remain connected in social engagement to their environment. When this doesn't happen, a child, there's actually now neuroscientific evidence to show that the way a child at this pre and perinatal stage of development, the only way that they have to be able to protect themselves from overwhelming experiences that are happening chronically, is actually the process of dissociation. And so there's this term in neuroscience, what fires together wires together, right? So as a child's, billions of neurons are being, created every day in these earliest moments, those billions of neurons are getting wired around the idea that any uptick in their system, in their biology, is associated with threat and gets hijacked by dissociation, by a disconnection from their physical bodies, their feeling states, and social engagement. And this gets wired in the brain and the nervous system, going to the root of how they start understanding themselves and the world around them. So when you bring somebody who's experienced this kind of early trauma, and then later on in their life, in teenage years, they're now in a really safe and nurturing and loving home, oftentimes that can actually feel really threatening to them. Because if you remember back to that quote, the original title of the Healing Developmental Trauma book, when we've experienced significant early trauma, connection is both our greatest desire. So this may be what this person has always wanted, and yet it's also their deepest fear. And so from this kind of internal conflict, oftentimes they can have really intense symptoms and behaviors getting hijacked through dissociative processes, acting out, shutting down, feeling really sensitive and overwhelmed. And it can really be confusing for the people that are trying to care for them, because they're doing the best that they can. And the best that they can, all the love and nurturing, is actually, while on one hand it feels really good, it also feels really bad. And there's a certain amount of helplessness that we all have to kind of manage inside of ourselves when dealing with that.
Yeah, it sounds like the old adage of, when's the next shoe gonna fall?
Exactly right.
So, thank you. And The next one, there's kind of two different questions here. I want to try to combine these. Um, you know, this attendee had said that, really on board with all this. How can this material be best shared with parents if they're unwilling to engage in family therapy? And another one kind of that ties into that pretty well. Does Family First ever suggest family members doing their own trauma work? Um, you know, I say this respectfully, but it's kind of truthful too. We usually don't have the sickest member of the family in treatment often. And so getting those families engaged in their own work, how do you guys approach that?
It's challenging. First off, what we do here at Family First, we do what I think is a really good job of kind of being very upfront in the front end of what our program is about. We are family first. The immersive family programming that we do, they're getting weekly family therapy with a family therapist. They're getting weekly sessions with the program director, twice weekly groups with me over Zoom, and twice weekly alumni support meetings. That's not including all of the different kinds of contact that they're getting from our education coordinators and case managers and everything and the like. During that process, they're creating their own individualized parent treatment plans around the consensual agreements that they're willing to make to work on their part in the family system. The first actual family session here at Family First, that's how we start it, is that after a little bit of a separation period of a couple of weeks, the first family session between the parents and their son involves the parents reading off their individual parent treatment plans, the agreements that they've made to work on their part in this dynamic. And then their son reads off their individual treatment plan. And so from this kind of mutual understanding of the consent, this consensual agreement of what everybody's willing to do in terms of their part, then they can start making agreements around what it is that they want for themselves out of the family therapy process. So that's kind of a little bit of an overview of some of how we tackle this. We kind of throw everything at it in a certain way. To the part around the unwillingness, that's it's true. The truth is, it's just really hard. We talked about earlier in the presentation around helplessness. This idea around helplessness, around not being able to impact or affect change in what's happening in a certain family system, is one of the most vital things that we as helping professionals need to really be kind of connecting with and aware of, because those same dynamics that I named about parents come up for us, our own unresolved complex trauma dynamics, where if we need to feel helpful, or if we need to feel as though we're needed by them, if we need to feel as though we're making some kind of progress, the challenges that are presented from the parents through, and this is strong language, but I don't mean it pejoratively, through parental narcissism, whether that be the belief that they need to be perfect parents in order to have their kids be successful, or the fact that, or on the flip side, that they need to have perfect children in order for them to not feel shame. And those dynamics getting in the way, being obstacles of kind of parental engagement in the process, there really is very little we can do other than be as direct as possible about the impact that it's making on the child. Being as direct as possible, and then being very transparent and real and authentic with the child around the limitations that they are going to experience because their parents aren't engaging in the process. So often I've done consultations for people for years around the trying to kind of soften the blow for kids around, you know, parents not showing up, not engaging, trying to kind of like get them to adapt to it or feel better about it, and the idea is that that's actually a certain kind of acting out on our part, oftentimes, of trying to make them feel better about something that really sucks. And when we can kind of drop our need to make them feel better about it and really connect with where it is that they are, oftentimes it supports a certain reconnection to the emotions that feel too threatening in relationship with these failures of the parenting dynamic that actually can support greater individuation.
Well, thank you very much. And you know, they go on to say that, you know, is having their child would rather their child attend to a therapy and do kind of fix it all with their child, as opposed to having some parts of their own being worked on. And then this is really kind of two-part. Do you find trauma is driving the training most of the substance abuse and mental health patients that you see, the young adult men like the adolescent boys? And how can NARM work with generational trauma?
Simply put, for the first question is yes. The answer is unequivocally yes. The wonderful part that I've never seen in another model so explicitly designed is that the approach around that in NARM is that we're not actually working with what happened to someone. We're not as concerned with the events themselves or what happened in these early developmental stages, because the idea is that it doesn't so much matter what happened to somebody as much as it matters how they adapted by disconnecting from parts of themselves in order to survive what happened to them. And because those adaptations being carried forward 10, 15, 20, 30 years later, and still being played out, that's what's causing the symptoms and behaviors, not the event. And so I actually don't need to know, when you have a roadmap that is of understanding these early developmental themes that we call adaptive survival styles, I don't need to know what happened to somebody to know how they adapted to it, because how they adapted to it is playing out right in front of me in the moment-to-moment relational interactions of the therapy. And that's what we want to actually focus on, is how someone is relating to themselves in this very moment that's either leading towards increasing connection with self and others and towards what it is that they want for themselves, or increasing levels of disconnection from themselves, others, and moving away from what it is that they want for themselves. The generational trauma question is a really cool question. I guess it's somewhat of the same answer, that there are very particular cultural, religious, intergenerational patterns that manifest themselves in how we were impacted growing up through the different parenting practices, cultural practices, stories that were passed down, all of these different kinds of ways that are historical, all the different ways that historical trauma or storytelling impact us across generations. And a young child doesn't experience, again, being differentiated from that culture or that historical material. They experience those things as being all about them. And so as they internalize these experiences that are left over, they adapt by making it about them and seeing what it is that is available to them in their environment based on those different kinds of experiences, the carrying forward. And then we're literally playing out generational themes from our family system that have long outlived their usefulness.
Yes. Well, thank you very much. And again, really great to see you. We've got to move on, and we've kind of went our time limit. We've